Hi, I'm Samantha Lewis at Cambridge Health Tech Institute, and I'm here with Danielle Scelfo, who is the Director of Government Affairs at Genomic Health. Danielle will be speaking at the upcoming Evidence-Based Reimbursement Summit this November 5th through 7th in Philadelphia. Thank you, Danielle, for taking a few minutes to speak with us today. My first question for you is, why is CPT code change important?
CPT code changes are important for a number of reasons, both to us as providers of service for both Medicare programs and commercial programs, but also for the payers that recognize the services we provide and pay for them. A couple of years ago, AMA, CPT, and their molecular diagnostic work group embarked upon a path to create more granular coding for those providers, both hospital and commercial laboratories like ours, to provide greater granularity to their payers so that when we submitted claims, they could be able to easily identify and recognize a test and pay for that.
Great. And my second question to you is, are there certain areas of diagnostics that will be affected more than others?
It's interesting that you mentioned that. I think that what this will do is it will really set policy in a number of different ways. As you probably know, CMS in their proposed physician fee schedule rule is asking for comments as to how these tests should be reimbursed. And their preference is to place them on one fee schedule, either the clinical lab fee schedule or the physician fee schedule. So I'm not sure if I would say that it would impact one lab more than another, but from a policy perspective, it certainly will have an impact on us all.
Great. And my final question for you is, what are you most looking forward to at the Evidence-Based Reimbursement Summit?
Well, these programs are always very informative. I think in particular, this format brings in a lot of well-recognized key opinion leaders, and so I always look forward to learning, what they're experiencing out there in both the government and commercial markets, trends that they're seeing as well too. Anything from things coming out of the Centers for Medicare and Medicaid Innovation to other, innovative ways of delivering, covering, and reimbursing for care in the commercial setting as well. One of the things that I think is unique about this program is that in our industry, personalized medicine and labs in particular, we're seeing a very big evolution into evidence-based coverage, which also translates into granular coding, which we saw supported by AMA CPT, and also as well too, that always then downstream trickles into reimbursement and how do we see policy shifts there. So we, Genomic Health, are big supporters of evidence-based coverage and evidence-based medicine. And so we really do support efforts like these to create greater transparency, both in the coverage process, coding, and reimbursement.
Great. Thank you so much, Danielle. Again, that was Danielle Scelfo with Genomic Health. And you can hear more from Danielle as well as other speakers this November 5th through 7th in Philadelphia at the Evidence-Based Reimbursement Summit.